Welcome to the topic, drugs for heart failure. Heart failure is the inability of the ventricles to pump enough blood to meet the body's metabolic demands. Treatment goals is that there is no cure for the heart failure, but we can prevent, treat, or remove the underlying causes that causes the heart failure. Heart failure is closely associated with disorders such as the chronic hypertension, coronary artery disease, and diabetes. The disorders commonly associated with the heart failure are chronic hypertension, which is a sustained high systemic blood pressure, coronary artery disease, which is caused by atherosclerosis of the coronary arteries. Diabetes is the lack of insulin or inability to tolerate the carbohydrates. Mitral stenosis is the inability of the mitral valve to open fully. Myocardial infarction is the heart muscle death caused by the coronary artery obstruction. The central cause of the heart failure is the weakened heart muscle. Now we have one term which is called as cardiac output. We got preload in the cardiac output. Before the chambers of the heart contract, which is called as systole, it is filled to their maximum capacity with the blood. So the degree to which the heart fibers are stretched just prior to the contraction. The more they are stretched, the more forcefully they will contract. So the strength of contraction is called as the contractility, which is also called as the Frank-Starling law. Then we have the afterload. Afterload is the pressure in the aorta that must be overcome for the blood to be ejected from the left side of the heart. And in heart failure, the myocardium becomes weakened and the heart cannot eject all the blood it receives. In this, we'll understand the pathophysiology of the heart failure. For example, here, it is showing you that the decreased myocardial contractility stroke volume or the decreased cardiac output will lead to either increased preload or decreased blood pressure. If it is an increased preload, it will cause pulmonary edema, that is the swelling of the lungs, and it will decrease the oxygen supply. Other side, if it decreases the blood pressure, either it will increase the heart rate and increase the myocardial workload, or it will decrease the blood flow into the kidneys. Either the antidiuretic hormone is released or it's the renin-angiotensin system activating aldosterone is secreted. If antidiuretic hormone is secreted, then the sodium and water retention occurs. And if the RAS activated aldosterone is secreted, then either the sodium or water retention or increased peripheral resistance occurs. Both ways, either the edema of the limbs, that swelling of the legs, and increased blood volume occurs, or increased afterload occurs, and finally there is an increased myocardial workload, which is a pathophysiology of the heart failure. Now, what are the signs and symptoms of the patients with the heart failure? Like upright posture, leaning forward, anxiety and restlessness occurs, skin cyanotic and clamminess occur, persistent cough, rapid breathing, fast heart rate, and edema of the lower limbs. So very common, if a cough is not going away after a prolonged period of time, then we also should check with the heart failure symptoms. The three primary characteristics of the heart function are the force of contraction, heart rate, and the speed of impulse conduction. So primary characteristics of the heart function, number one, as I explained, is the force of contraction. What is it? It is the ability to increase the strength of contraction, which is also known as the positive inotropic effect. And the cardiac glycoside is the name of the drugs like digoxin. They are engaged with this process. Then there is an electrical conduction occurs. Slowing the conduction speed through the heart will decrease the rate and the cardiac workload. Then we have third is the heart rate. The faster the heart works harder, but not necessarily more efficiently. A slower heart has a longer time to rest between the beats, decreasing the workload on the heart. So the mechanism of action of drugs which are used to treat the heart failure is the plus will show the stimulation and the minus will show the inhibition. So these are the arterioles. If it's an adrenergic blocker, we give the drug, what will they do? They will decrease the cardiac workload by slowing the heart rate at beta-1 receptors and decreases the blood pressure alpha-1 receptors. For example, carvedilol comes under the adrenergic blocker and its mechanism of action is this. If we use dilators, they're dilating the vessels, but how? They decrease the cardiac workload by dilating the vessels and reducing the preload. For example, isosorbide dinitrate with hydralazine combination drug. If we are using ACE inhibitors and angiotensin receptor blockers, they are inhibiting. So they increase the cardiac output by lowering the blood pressure and decreasing the blood volume. For example, all the prils, lisinopril, fosinopril, captopril, and enalapril. Then we have phosphodiester inhibitors. They have a stimulation effect. They increase the cardiac output by increasing the force of myocardial contraction, for example, milrinone. Then we have cardiac glycosides. Their stimulatory effect, they increases the cardiac output by increasing the force of myocardial contraction. For example, digoxin is the most common cardiac glycoside. Then we have some diuretics. They also have the stimulatory effect. They increase the cardiac output by reducing the fluid volume and decreasing the blood pressure, for example, furosemide. So we can see there are drugs, they're acting on arterioles, there are drugs which are acting on the heart, and there are the drugs which are acting on the kidney to treat the heart failure. So the specific therapy for the heart failure, it depends on the severity of the disease, that how severe it is. First, we use the non-pharmacological methods for controlling the heart failure, like stop using tobacco, limit the salt intake, and be sure to eat the foods which is rich in potassium, like banana and magnesium. Limit the alcohol consumption, implement a medically supervised exercise plan, learn and use the effective ways to deal with stress, reduce the weight to an optimal level, and limit the caffeine consumption. Now, the first drug that we talked about is the ACE inhibitors. They are the preferred drugs for the heart failure. They affect the RAS system, they lower the blood pressure, they reduce the workload on the heart, they increase the cardiac output, and they decreases the preload, reduces the pulmonary congestion and the peripheral edema. They are very effective drugs. They're relatively low potential for the serious adverse effects, and the first choice drugs in the treatment of the heart failure replaces the cardiac glycosides also, the digoxins. Next comes to the diuretics. The diuretics, they relieve the symptoms of the heart failure by reducing the fluid overload and decreasing the blood pressure. So they are commonly used for the treatment of heart failure, but they also have few adverse effects, usually prescribed in combination with ACE inhibitors and other heart failure medications. They are effective at increasing the urine flow. They lower the blood volume and reduce the edema and congestion. So very good drugs. They reduce the fluid overload and lower the blood pressure. The workload on the heart is reduced, so the cardiac output is increased. Third category is cardiac glycosides. They increase the force of myocardial contraction and were once the traditional drugs of the choice for the heart failure. So what is digoxin doing? It increases the force of contraction, shows the positive inotropic effect, allows the weakened heart to eject more blood per beat, increasing the cardiac output. The second important action of the digoxin is it slows the electrical conduction through the heart, resulting in fewer beats per minute, and it reduces the heart rate combined with more forceful contractions, allows for much greater efficiency of the heart. Next category of the drugs is the beta-adrenergic blockers. They are used in combination with other drugs to slow the progression of the heart failure. They block the cardiac actions of the sympathetic nervous system. They slow the heart rate. They reduce the blood pressure. Workload on the heart is decreased. An example is carvedilol, bisoprolol. All these two lols, they are approved to treat the heart failure. Next category of the drugs is vasodilators. They reduce the symptoms of the heart failure by decreasing the cardiac workload. Two direct-acting vasodilators. First is hydralazine. The brand name is aprisoline. Then is isosorbide dinitrate, which is called as isordal. Act directly on the vascular smooth muscles as they are the vascular dilators. They relax the blood vessels and then they lower the blood pressure. Next category of the drugs is phosphodiester inhibitors and other miscellaneous drugs. They are used for the short-term therapy for the advanced heart failure. They block the enzyme phosphodiesterase. Anything ends with ase is always an enzyme. So it blocks its activity in the heart and in the smooth muscles. It increases the amount of the calcium available for myocardial infarction. So the two main actions that benefit the patients with the heart failure is an increased force of contraction by this drug category and the vasodilation. What are the main key drugs that we studied in the heart failure? ACE inhibitors, captopril, enalapril, lisinopril, ramipril, trandolapril. So all ends with the pril. Then ARBs, sartans, candesartan, losartan, valsartan. Beta blockers, only two lols, bisoprolol, carvedilol. Then we have calcium channel blockers, amlodipine, felodipine. Then we have cardiac glycoside, which was sometimes is the first choice of the drug, but now is the ACE inhibitors. It's digoxin, direct acting vasodilator, hydralazine, isosorbide dinitrate, loop diuretics. One type of the diuretics is bumetanide, ethacrylic acid, and furosemide. It reduces the edema. Phosphodiesterase inhibitor is milrinone. Potassium sparing diuretic is the eplerenone and spironolactone. Thiazide diuretic is hydrochlorothiazide and metolazone. Vasodilators is the nitroglycerin. So in the nutshell, we did summarize that heart failure is not a distinct disease, instead involves a number of pathologies that affect the heart. The central cause is a weakened myocardium, and the characteristics of the cardiac function is the heart rate, force of contraction, speed of impulse conduction. The disease severity will dictate the therapy. And the ACE inhibitors are the first line medications, and the diuretics, cardiacs, glycosides, beta blockers, vasodilators, and phosphodiesterase inhibitors are also considered in this one. Thanks for watching the video.